Good afternoon, I'm Jill Valley. In just a few moments, Montana Governor Steve Bullock will be talking to the state, providing updates on Montana's response to COVID-19, answering questions from reporters. This comes on a day where we have now confirmed our 9th death from COVID-19. This happened in Cascade County. It was a woman over 65. Let's go now to Helena.
Is from becoming overwhelmed. We've worked to protect our vulnerable populations and remove as many people from the chain of transmission as possible, both to reduce infections, but also to save lives. In short, we have flattened the curve, and we have saved lives. Today, we have 422 confirmed cases of COVID-19 in Montana. We've had an estimated 233 patients who've recovered and 21 active hospitalizations. And we've now tragically faced the loss of 9 Montanans. Earlier today, the Cascade City County Health Department announced the 9th death in Montana due to COVID-19. Each and every one of those losses weighs heavily on me, not just as a governor and a public servant, but also as a father and as a son. And I know that they weigh heavily on all of us as a community in the state of Montana, where we all care about our neighbors. Because we acted early with input from public health and emergency response experts, Montana does have a significantly lower rate of infection per capita than many of our neighboring states that have not implemented stay-at-home directives. The aggressive actions that we took early has made it so, relative to many places in this nation, we're in a much better position. But even as we look at our neighboring state, South Dakota, for an example, has 1,411 cases, even though we've performed about the same amount of tests. North Dakota saw its biggest single-day jump of cases yesterday. Yesterday, President Trump convened a call with the nation's governors and laid out guidelines on reopening our economy. On that call, the president told us that we governors will call the shots in our own states. And first, I want to say thank you, Mr. President, for recognizing that every state is different. Here in Montana, we have been able to keep our cases relatively low because we know what's best for our state and because we care about our neighbors. Over this past month plus, Montanans have demonstrated their individual independence and strong sense of community yet once again. Montanans have protected their family and friends by communicating virtually. They've stayed home while finding ways to support local restaurants and other businesses providing takeout or delivery services. Business owners and entrepreneurs have shifted their efforts to producing 3D masks or producing hand sanitizer to help fight this virus. And again, these efforts haven't been for nothing. Together, we're not only saving lives, but also making it so that we will be able to reopen our state and get our economy thriving again long before many other states will be able to. Yet I know that Montanans are hurting financially. We all want to get Montanans working again. So we're taking those steps to get there. Even last week, before we knew what this week might bring, with positive cases, with challenges in our communities, been working with both public health experts and business leaders to determine how we can open our state up while keeping people safe and avoiding a new outbreak or becoming the next hotspot in the region. Earlier this week on Wednesday, it announced the creation of the Coronavirus Relief Fund Task Force to help sustain Montanans through this pandemic and put the state on a path to economic recovery. Montana will receive $1.25 billion to respond to the crisis and support governments and Montanans who need it most, small businesses, workers, tribal communities, nonprofits, state and local governments. Over the upcoming weeks, the task force will examine the sectors of our economy to understand the impacts of COVID-19 on Montanans, consider the unique needs of each region of the state, and provide guidance on how best to utilize these funds, not only for immediate needs, but to help set us toward a long-term path to economic recovery. Now, we're still waiting to actually receive federal guidance on the specifics of how the $1.25 billion can even be spent and the funds itself in full. But when we do, we'll be ready to hit the ground running to best support Montanans and businesses. It's more than just how to spend money, though, coming from the CARES Act or the federal government. We've also been working on how we can actually get to the point so Montanans can both earn and spend more as well. General Quinn is leading a process based on really the military strategic planning principles to look at when and how Montana can safely begin to take the steps to reopen. Process includes the expertise of public health, emergency responders, local providers, and businesses and industry leaders. We need to do this right, having thought through many of the very issues that any individual business would be trying to come up with or considering as well. Let me be clear, the stay-at-home directive expires April 24th, along with all of our directives, because we've been trying to keep them in a 2-week period to make sure that we can both adjust and readjust based on what's happening in the ground. And that stay-at-home directive is in effect through April 24th. It'll stay in effect through at least next Friday as well. After April 24th, we'll move forward with a phased reopening with guidance provided by General Quinn and experts. Not unlike what was recommended yesterday at the federal level, we all need to understand that this will be a gradual process, because once we begin to reopen, we want to be able to stay open. And we got to recognize our new normal is going to look a little bit different. The virus isn't going away, and we're going to have to continue to adapt with how we live with it for the next while. By next week, we'll have a deliberate plan for reopening, but that'll also include thoughtful planning in the event that we face any setbacks. It will be a phased reopening. Like the president said yesterday, this is going to be a process. There's several factors that we're taking into consideration. Some of those metrics President Trump laid out himself yesterday, and some of them are unique to Montana. I continue to consult with public health officials that if we don't see a surge in new cases, there are at least a handful, small 3 or 4 primary markers at this time for phasing and reopening. First, there has to be a sustained reduction of new cases for at least 14 days. It's important because 14 days is the incubation period for the virus. We have been tracking our cases closely in Montana, as have all of you. Last week, we saw a decline in new positives, and I expect the same this week as well. Second, we need to make sure that our hospitals are able to safely treat all patients, both COVID-19 and those with other conditions, especially in our rural areas. Third, we need to make sure that we have the capacity to test all people with COVID-19 symptoms, and the capacity for our state and local public health officials to conduct active monitoring of newly confirmed cases and their contacts. And while our state lab has been able to sufficiently perform testing, we do need to ramp up our testing capacity yet even further. We still at times certainly have challenges with shortages with swabs and reagents, which impacts our capacity to test on the ground. We're working on it, but as every governor will tell you, we need the federal government to be working with us, certainly not competing with us. We'd requested about over 30,000 swabs from the federal government over 3 weeks ago, received a modest number, about 4,000. With 1 million Montana residents, that doesn't necessarily get us far enough. Yesterday, governors across the country, both Democratic and Republican, voiced concerns about testing to the administration. I brought up a specific need that we have here in Montana as we wait on test kits to actually be able to perform testing using the fast testing Abbott machines we have in stock. Several weeks ago, there was the discussion we were receiving 15 of these rapid testing machines, which can actually cause, if you're positive, you'd know in 5 minutes. To date, though, even with the last shipment, there's only about 40 tests for each of those machines. And had asked, I think there was a thought that we'd received more. The President assured me that we'll get the test kits we need. And certainly sure hope that he delivers on that, and I'll be working my hardest to make sure of that. But we also know that in some respects that we've heard promises at times from Washington that haven't always completely materialized. And finally, we want to reopen it in a way to work with our business, our public health community, and Main Streets. We want to do it in a way so they will have thought through some of these challenges of what a new reopening might look like, and they'll be prepared. Again, I want to open up Montana as much as any Montanan out there. That's why we've been at that process to do so. But we'll do it responsibly in phases in order to ensure that we keep the curve flattened, so we can mitigate the risk, knowing that the risk still is there. We'll do it in a way that will protect Montanans' lives and the recovery of our economy. We'll continue to do this the Montana way, based on the data and science on the ground here, not based on politics. And I know that this crisis is hurting Montana and Montanans, but I also know that if we get this wrong, it'll hurt us even more. In times of crisis, Montanans have always pulled together. That's how we've slowed the spread, protected our nurses and doctors, and saved lives. We need to continue to keep working together, keep taking care of our neighbors, and keep doing what's best for Montana. With that, I'd be happy to open it up to questions. You press 5* if you have a question. First phone question.
Hi, Dr. Bullock. It's Marie Bullock from Montana. Wondering if the plan for a phase reopening similar to the plan out in Texas today, and what?
So I missed part of that, Maritza, that the plan for reopening and what?
And what does it mean for schools? As like Texas, that schools are going to close the rest of the year.
So I think the question was, as you look at plans for reopening, what's it look like for schools? Texas had announced that schools are closing for the rest of the year today, apparently. I think what...
If your plan looks similar to what Texas unveiled today.
To be candid, Maritza, I haven't had the chance to take a look at what Texas had unveiled today. And I think that what we'll be doing is both looking at, as we have, let science guide this thing along the way. All of the directives expire April 24th that aren't renewed. I mean, I think even under the president's plan, which schools wouldn't reopen until the second phase, that we're not there yet, for sure. Been talking to educators though, and I recognize the better guidance we can give earlier, it's easier for them to plan. And I also recognize that at the end of the day, that this is, to the extent that I would lift the statewide directive, I mean, we are a local control state, so that decisions may well be made at the local level. But there's a lot in there, and that's why, just as we try to be deliberate in the directives that we issued along the way, we want to make sure that we're deliberate in anything that would allow a business or a school to reopen. And there is guidances, not just at the CDC level, but as our public health department has been working on as well to try to say what might that look like. Another phone question.
Hi, this is Phil Drake.
Hi, Phil.
Hi, sir. I was wondering about Toole County. It seems like the problem is somewhat growing up there. Are there state officials working up in Toole County, or are you at all concerned about putting more resources or anything like that up there?
Phil, there has been, and I was there last week. I mean, there's regular communications both with the healthcare community and others as well in Toole County. I mean, we have National Guard soldiers working at the assisted living facility. We've had Dr. Holzman in regular contact as well. And that's, you know, it does underscore, though, too, the challenges and why we have to be concerned, urban and rural, from the perspective of that Toole County's been hit significantly hard. And once you actually have COVID-19 positive cases, in some ways, while we look at these cases each and every day when the positive tests are reported out, it's reflecting not just what's happening today, but what's happened over the last 2 weeks. Do you have anything more you?
That's right.
Want to add?
That's right.
Thanks, John.
Question.
Good afternoon, Governor. This is Chris Peterson. I'm wondering, there was a Montana solution, so to speak, for masks. I'm wondering, is there a Montana solution for tests?
There was a Montana solution for what, Chris?
For tests. Is there a lab in Montana that could make this test?
The test kit.
Yes. So, Chris, we have been over the last 5 weeks talking to both private labs. We've worked on, and we're actually getting some equipment from the veterinary lab that we're going to be able to stand up in our state public health lab. Hopefully it'll be all through by its verifications, just increasing the ability of what we can do. That'll be stood up by the middle of next week if all testing goes through. And I also know that there are private sector labs that are working on everything from, you know, what a vaccine might look like. But the challenge really becomes in part is the testing kits for the existing testing machines and abilities that exist today, not creating anything new. So we have labs in hospitals that could increase testing as an example, but they too are having supply chain issues. Making sure that you have the medium and transport for the swabs and actually getting the swabs remain a significant challenge. And then as we look to reopen, I mean, one of the things you want to be able to do is have the ability to, as you contact trace, really be doing fast testing in a specific community, knowing that everything we're trying to do is save every community in Montana from having like what happened in Toole County. And those are specific testing kits that come from specific machines. Other questions?
Yeah, Governor, this is Troy Shockley from the Montana Radio Company. Like you mentioned, every state is different. So many of Montana's counties are very different. A lot of counties, of course, struggling with cases in greater numbers than others. And you've mentioned before the possibility of opening up the state sort of on a county-by-county basis. Is this phase reopening that you're looking at across the state, or are you looking at different things in different counties potentially?
Yeah, and thanks for the question, Troy. The question was, would a phased reopening be everything across the state, or could you even be looking at county by county? And that's what this planning process that we've been going through really is to underscore and to nail down in the best possible way. From the perspective of, yeah, certainly some counties in our state haven't been hit as hard, or at least don't have even a positive reported case to date. But we also know that in our rural areas that it could take a lot fewer cases to substantially impact or overwhelm the healthcare providers. So through the planning process that we've been working on and have an expectation by early to mid next week that be able to lay that out with even greater transparency. One of the things that we are considering is whether you would do regional or area openings at different rates. So,
This is Holly. Can you hear me?
Holly, I sure can.
Okay, so I must be just over confused today, but can you sort of walk me through, so these orders that we're under now expire a week from today, and you lay out some of the metrics that you'd like to see. Like, are we on track then to have that phased reopening if we follow? Like, are we there with testing capacity, with the hospital capacity? I just want to make sure I'm understanding all that clearly. And then, would that be thrown on if we saw a spike in cases at sometime next week or something?
Yeah, so, and Holly, that, as I've said time and time again, right, like this is a fairly rapid and dynamic issue. So even as we began to look at the possibility, what it would take to reopen, that was over a week ago, and we didn't even have another week's data. So we'll continue to assess from that perspective. Now you look at, like if you look at what the president's standards would be for reopening, right? There are parts of it that, like to even get to that first stage would be that hospitals would have to be able to treat all patients without crisis care, and robust testing program in place for at-risk health care workers, including emergency antibody testing. There is no antibody testing that's generally used right now. So by some of these standards, there's no state that could get there, even today. But so what we'll be looking at specifically is, and a continual assessment of what is our testing capability out there. I mean, just as we've worked every single day to get additional PPE, laying that out as we go forward. So it's not just sort of the sheer number of positive tests, it's the infrastructure that's there, but it's also the preparation for businesses. That is yet another example of what the president rolled out yesterday. It said, more or less, guidance or an expectation that every employee that comes in is temperature checked. Well, we've got to make sure that our businesses in this state understand exactly what the expectations or the encouragement is from them as we go into a reopening as well. And I would anticipate it would be a phased reopening. Did that answer your question, Holly? Go ahead.
A little bit. I mean, so an understanding per day.
You might,
Over the coming week.
one more time, I'm sorry. Start from the beginning because you cut out a little bit.
Yeah. So understanding you can't predict what case growth will be, but in terms of testing capacity or hospitals, like, are we on track to be there next Friday?
That's one of the things through the planning process that we're working on each and every day. I mean, I hope by an expectation by middle of next week to be able to say, here are some of the things that we will be moving toward after April 24th.
Thank you.
Sure.
Phase 2 is kind of where schools would start reopening it. So if we do get to that point, is that something you're considering? Is that you're leaning towards opening schools to get there?
So there's a couple things, and I'm saying at least in the CDC guidelines that were released out yesterday. That's what they proposed from a phase 1 to phase 2 steps going forward. At the end of the day, the directive closes. I did a statewide school closure directive, but it would still be up to local superintendents and local school boards, even if that directive is lifted, to both decide if they can reopen for the rest of the year and what that would look like. meaning that, and that's part of the planning, at least knowing it's a local decision that we want to be able to provide assistance to, knowing that be it a school or a restaurant, things are going to look different with partial reopenings and full reopenings than they would before coronavirus came.
Kind of follow up to that, if schools, if restaurants and the economy starts to slowly open, do you have any specifics as to what that will actually look like? And you can say that'll look different.
You mean what will be different?
Yeah, from what was different.
Well, you can even go from the perspective of, and that's exactly, first of all, what sort of a calculated work with public health, working with industry as well, of saying, how could we do this in a thoughtful approach? I mean, that's a planning process that's been going on even today. But as but one example of, like, even if you looked at the 3 phases that were rolled out yesterday, right? Like, phase 1 said no gatherings of 10 or more. Social distancing still occurring. Masks being encouraged. Phase 2 was, well, you might be able to ratchet up from 10 to 50. Our vulnerable population, our most vulnerable population, individuals in nursing homes and assisted living, even as we look at that, we have to be both protective. So things will look different, certainly, than they did before. Yes, ma'am.
Montana has already met the gating criteria according to the president for these phases. Can you touch base a little bit on that? You mentioned it yesterday in this press conference. A lot of people were asking about, states like Montana, Wyoming, Utah, and things like that, and really having to meet that gating criteria. So can you just touch base on exactly what that means for our state?
Yeah, and first and foremost, I appreciate the desire for all of us to be open. And even the gating criteria that the president put out yesterday, we haven't met those criteria. But that doesn't mean, like, as I recently mentioned, the antibody testing, or that you have to have the ability to have, even under these guidelines, that you have to be able to make sure that as new positive cases come up, you have all the testing capability right there into that community. And like, these 15 Abbott test machines are great, but you'll burn through 40 tests in one day, even today. So having that base infrastructure there along the way. And I am so pleased that Montanans have taken this seriously. And I'm pleased that we will be, even under sort of the criteria, by this weekend, we'll have hit, knock on wood, hopefully, 2 weeks of not an increase, actually declines in cases. And I'm pleased that Montanans have taken this seriously, because that's what actually affords us the opportunity to start saying, under both the guidance that are put together by our local public health officials, and by and large consistent with areas where the federal government is making at least some suggestions or recommendations, that we can do that in a time where a whole lot of states still won't be able to. Other questions? Oh.
Sorry, Governor.
Oh.
2 questions. First one is more of a clarifier. So for the downward trend in cases, is that an average, or does it need to go down every day? Because obviously
no, yeah. And even if, you read sort of what was put out yesterday, it's not always necessarily clear even what they're thinking, right? It said, downward trajectory of documented cases within a 14-day period, or downward trajectory of positive tests as a percentage of total tests within a 14-day period, flat or increase in volume of tests. And this isn't what's going to guide our decisions, and we had even been speaking about before this, and there's a lot of discussion about where are you in over a 2-week period, or week by week. We actually have been declining, And I think by the end of this weekend or Saturday or something, we'll be at about 14 days where hopefully we'll be able to say, if you look at it a week by week period, our positive tests have been declining. So it's not a day by day like, oh, we're doing so good. And then all of a sudden Saturday hits and there's X number and it's just like, forget it. Things will be shut down forever.
Fair enough, sir. And then another question. It was announced this week that the Small Business Association or program ran out of money. The majority of Montana businesses are small businesses. Is there anything that your office can announce or are working on to help Montana businesses who are worried that they're not going to be able to reopen without that federal assistance?
Yeah, well, there's two different things occurring in that. One of which is that, and Montana banks and Montana businesses stepped up and actually applied for a lot of the paycheck protection program, as well as the SBA loans. And I think that there will be we've talked about on the governor's calls, and there was some discussion on the White House call, there is an appetite to extend additional dollars to ensure that other businesses in Montana and elsewhere around the country can actually seek some of those dollars. But that's what we are also doing with this, what I announced on Wednesday, the Coronavirus Relief Fund Advisory Group, trying to say not to supplant or do the same things that the CARES Act did, but are there other ways that we could deploy some of that money to help our Main Street businesses? Phone question.
Yeah, Governor, it's Maritza Georgia, again from NBC.
Hi, Maritza.
I'm wondering if you could clarify, is the phased reopening dependent on us continuing to stay at home until we are otherwise continuing social distancing?
So Maritza, the stay-at-home directive and all of the directives are still in place until April 24th. And I'd ask Montanans patience and understanding in complying with those directives. And as we look at social distancing, I think that there will be expectations of businesses. Like, let's just even looking at what came out from the CDC yesterday, guidelines for all phases for employers, expectation of social distancing and protective equipment, temperature checks. And this is on the employers, testing, isolating, and contract tracing, sanitation, use and disinfection of common and high traffic areas. So that I think even as we reopen facets or remove some of these directives, that there will be expectations of things like social distancing and masks. Another phone question.
Hi, this is Parent Stein from the Bozeman Daily Chronicle. I was wondering if you could talk about whether you're working with other governors in the area to discuss more collaborative reopening measures that might cross state lines, or how you're thinking about that at all.
I'm Terrence, and have had regular conversations with governors, not just close by, but indeed around the country. And that's like every single day in many respects. But I do look at Montanans took this on, they took it on aggressively. And Montanans have done a lot to take care of their neighbors, their friends, and their communities. And that's not, every state's been doing their own good things, but I think our decisions to open up and how we do it and what we expect of Montanans will be driven by Montanans, not other states. Another phone question.
Hi, this is Nikki Willett from Yellowstone Public Radio. Thanks so much for holding this conference. I'm curious, Montanans can do everything right, and you can write rules that might help control the virus within the state, but I'm thinking to the summer, and you know, if we're a tourism hotspot. So what risks is Montana facing from potential visitors from out of the state?
Yeah, so Nikki's question was Montanans can do everything right, but then what risks are Montana visitors, or what are Montanans facing from people coming out from other areas for tourism related or to enjoy everything that Montana has? First and foremost, like even as Montanans do things right, as we get to a partial reopening, I do expect that we'll continue to have some COVID-19 positive cases. So that really is doing every piece that we can to mitigate and minimize that and make sure that we have both the supplies that we need and the healthcare facilities if we were to flare up. Directly to the question though, that's also part of the overall planning process that we're undertaking, is recognizing that we can control our destiny to a certain degree, and also recognizing when you talk about industry that's been hit, the tourism industry has been significantly hit. So as we look at phased reopening, Nikki, that's part of how we can be most protective, yet how we can also make sure that people can have their livelihoods. Another phone question.
Hi, this is Luella Bruno with the Bighorn County News in Hardin. I had two questions for you today. Several entities, including the Montana Department of Health and Human Services, report that Montana's Indian reservations have the highest rates of chronic illness in the state, as well as the highest rates of homelessness. It's well known that those transient populations move from county to county to county. And in this area, the most common route would be Yellowstone, Bighorn, Rosebud County, and back and forth and back and forth. Well, we've recently found out that 2 cases of positive COVID-19 have come out of Rosebud County from multi-generational homes, transported to hospitals and Billings, where they subsequently tested positive, were reported as Yellowstone County numbers because their official address was Yellowstone County, but no investigations took place, no courtesy calls were made to either Bighorn or Rosebud County. So what types of policies are in place, or what types of courtesies are in place to ensure that those types of conversations are being held between the health departments in neighboring communities, neighboring counties, to ensure that, because especially these Native American populations, they have really close ties to their communities, even if they are moving out of county.
No, sure, and I appreciate it, and I'm not sure what you were saying as far as a direct communication between counties. I know that
well, we did have one case came out of Pryor. Well, we had a tribal member who lives in Yellowstone County, but technically still in the Crow Reservation, and they get their medical services in Billings.
Yeah, okay.
So Billings, Yellowstone Public Health gave Bighorn a courtesy call and said, hey, there's a tribal member that tested positive. They didn't give names. They protected their HIPAA rights. But just as a courtesy, because a lot of the investigation would take place in Bighorn County. And that was a nice courtesy for them. But there was nothing like that happened with the 2 cases that came out of Rosebud County.
Sure, and I think a couple of things. You raised 2 issues. One, which is that in county health officials, and they are doing contact tracing along the way. So no matter where like if someone tests positive in Billings, and those local public health officials are asking where all have you been over the last 2 weeks, and actually reaching out to those individuals to ensure that there is sort of that seamless web of knowing where else there could have been positives. And I do know that county health officials on a fairly regular basis are in communication with one another, and at times collectively as a state. Calls that I'm not always necessarily on, but have had a lot of individual discussions with our county public health officials as well. But then the other thing that it raises is sort of some of the challenges unique to our tribal nations, and not only myself, the Lieutenant Governor, Jason Smith, and others have been in contact with our tribal nations, not just saying, go it alone with Indian Health Services, but where can we better coordinate along the way to try to keep our communities safe.
One question.
Hey, Eric Teacher here from Washington Press. Another testing question. I'm thinking in some ways a follow-up to what I was thinking. So thinking about this idea that we can scale back social distancing measures faster in parts of the state without new cases or without recent reported cases. Have we done enough testing in those cases to be confident that counties are back coronavirus free?
So I think Eric's question was if you could end up scaling back in specific counties or others, as opposed to statewide directives, do we have the confidence that enough testing has occurred to be able to do that? Look, even as we do scale backs, there's going to be scale backs of the directives. It's not like this virus is going to go away. So that whether you're in a county that has had a lot of COVID-19 positives or none reported to date, that doesn't mean that the actions that they should be taking as we do this in phases are really that much different, meaning that the social distancing will still be either encouraged or required, meaning that you have to take those precautionary steps. And I recognize, from my perspective, I would always like to be testing more. And I think that everything that we can do along the way to make that happen is better for Montana, not worse by any means. Now, I also do have a degree of a level of confidence because some folks would turn around and say, right, well, your numbers are so low because you haven't tested enough. Well, we fall per capita right in about the middle of the country for tests per capita, but our numbers of hospitalizations and indeed deaths would be a lot higher if we had a lot more of the virus out there that was just going completely undetected.
All right, you've been listening to the governor talk for about an hour now. Basically, we have a glimmer of hope on the horizon for an upcoming plan for a possible partial opening of some parts of Montana. Not very definitive. However, next week he says that they will have a more deliberate plan to do a gradual reopening. Him saying that we'll reopen for business, but once we reopen, we need to stay open. So how this looks is not going to look the same as it did before. He did not extend his April 24th directives at this point, although that could still happen. No word yet on what's going to happen with schools either. It sounds like, in listening to him, that's a separate conversation. So again, where businesses and people out there are not getting, something set in stone that you can count on that may or may not happen next week or the week ahead, at least there is hope that the conversations have begun to figure out the proper way to gradually phase our economy back into action. He did say that even if he does remove some of those directives, things like social distancing and wearing a mask in public might very well still be a part of what we have to do every day. Again, he reiterated things will look different. And it's probably going to take a lot of collaboration between businesses and schools and all these entities to figure out exactly how this is going to happen. He did reiterate Montana got $1.25 billion from the federal government, and his coronavirus relief task force is going to be talking to businesses and nonprofits and tribes across the state to figure out the best way to spend that for economic recovery. Still waiting on guidance from Washington, D.C. about how that can be spent, who can get the money, and when it actually might end up in Montana's checkbook. He did thank the president for recognizing that the state should take the lead in figuring out how to get ourselves back to normal. So again, where you can't point to something right now and say, here we go, we're going to open back up, it's going to be okay. It's going to be okay, but it's going to be very gradual and slow. And next week, we may have more of a picture as to how this is actually going to happen, which is better than we were this time last Friday. So there's the hopeful news for you there. We'll break this all down for you and have it coming up on the 5:30 news tonight. Until then, enjoy your nice sunny afternoon.
Dan, one of the things that business folks have said to me, which I think is absolutely right, who say they're hurt. And they want to be open as much as anybody else does out there. But they want to have some degree of confidence of what this new normal would look like, and the knowledge that it's not, well, we reopen on Monday and have to shut down the state again on Tuesday or Wednesday. I'm impatient, but I also know that lives and healthcare workers and first responders are also at risk, so we have to let the science dictate this and do it in a way that's going to be least impactful to the health of Montanans as we reopen. Someone's live.
Oh, this is Holly again.
Hi, Holly.
Two questions, not related, but one, I'm wondering, as we're looking at the metrics and seeing cases lower than what we need to see for this phased in reopening, if there was a spike, somewhere like looking at Toole County, and they said today they have another healthcare facility where there's a case confirmed, and we saw an increase in cases, but it was really localized to one situation we knew, if that would affect how things would look on the statewide level. And then the other question I'm wondering is, as we're looking at maybe some businesses being able to reopen in some capacities, and understanding so many of the state are so stressed financially right now, if that CARES money, like if we know that could be used to sort of help them in terms of if you're going to Blackfoot here, part of that is they need hand sanitizer or masks for customers or employees or something to help them purchase the things they might need to reopen under what new requirements might be.
Yeah. So Holly's first question would be, so what if we see a spike in another community, or an extension of that in Toole County? Would that change everything that we're talking about as we look at this reopening? I mean, I would love to, even as we get to reopening, I'd love to give the assurance that there won't be any more spikes. That we won't be able to give that assurance until COVID-19 has gone away or there's a vaccine. So that won't necessarily dictate what happens, but that's also, there's a system too where, like if you look at every directive that I've put out, the directive have said, this is a statewide directive, that doesn't preclude local county health offices from taking more stringent tests or putting in more stringent regulations into place. And I anticipate and I expect that that's one of the things that we will see going forward, is that there will be times where, well, there may not be a statewide directive, that individual communities will have specific guidance for the businesses and the individuals in that community or county. And to the question of, could the CARES Act dollars be used to help mitigate or assist some of the businesses in what are additional expenses that they might have in reopening? Your specific example was hand sanitizers, or, I was talking to a business person this morning that spoke about, and it was great in the way that he did it, because he goes, I'm trying to go out and get surgical masks, or just the Home Depot masks even, if you will, for all my employees, but I don't want to be in a position where what I'm ordering and trying to get a large amount might actually impact our hospital's ability to get what they need. And I think that there will be the opportunity at the statewide level, just as, like, look, if we've gotten more N95 masks for hospitals, what we do is then push those supplies out to nursing homes and hospitals and DES across the state. But I think that